Good afternoon, everyone. It's a great pleasure for me to introduce our next speaker today, who is going to talk us about the Kuwaiti board. Dr. Sulaiman Alhuwais, AGU graduate 2017, completed internship in Farwania Hospital and worked as an orthopedic assistant registrar in Farwania Hospital 2018. Currently an R2 Kuwaiti board orthopedic resident at Al-Razi Hospital. Dr. Sulaiman, you are welcome to start now, please.
السلام عليكم يعطيكم العافية جميعا. Good afternoon. الصراحة في البداية أنا يوم قالوا لي الشباب عن career day I was shocked and I was happy the same time. لأن this is the 5th annual AGU career day. 5 years ago exactly we did the first AGU annual career day. I'm very happy to be part of this year's career day. At the same time, I'm feeling a bit old, and it's been 5 years since the first one. So let me start my slides. So are you seeing the slides?
Yes, doctor.
Yes, okay. This will be my talk, inshallah, internship in Kuwait and Kuwaiti board orientation. Just a sec. We'll go through how to apply for internship in Kuwait, the internship year itself, the duties during the on-call and the working hours, what is KIMS, how to apply for the Kuwaiti board, and my personal experience and some frequently asked questions. And at the end, I'll be putting some important links and QR codes, so you just can screenshot your screen or just take a picture, and later on you could have all the links and the slides itself. I'll be sharing it with you. In a nutshell, the life cycle of in the medical field, you graduate from the medical school, then you do your 1 year internship. After the 1 year, you'll be assigned as an assistant registrar, which is the time of the trials to get accepted in your future residency program, inshallah. And after that, you'll be starting your residency program. Approximately how long does it take to be a consultant in Kuwait? Just to put you in a timeline. It takes at least 15 years, so you'll be doing 3 years of registrar. Then inshallah, when you're becoming a senior, you'll do also another 3 years, then 3 years of a specialist, then senior specialist, and eventually, inshallah, at the end, consultant. Very briefly, how to apply for the internship. Also, I'll be applying a link at the end. It's very helpful. It was done by our colleagues a couple of years ago. It's very beneficial. We've been using it for the past years. It has everything, even locations, Google Maps, everything, and numbers that you could use. It takes approximately around 4 to 6 weeks to complete the whole process of applying between the Ministry of Health and KIMS. What are the available routes after the medical school in Kuwait? You can apply for the Ministry of Health, which is the most common and popular route for the newly graduated medical colleagues, and you can apply for the Ministry of Interior and the Ministry of Higher Education. Internship in Kuwait. It is an internship year, so it's 12 months duration. You do 4 months of general surgery, you do 4 months of internal medicine, you do 1 month of obstetrics and gynecology, and you do 1 month of pediatrics, and you have 2 months of electives. You can do 1 month of each, whatever you want to choose. I call them Corona trainees. The recent trainees for this year, they were asked to do 2 months of public health, and they were distributed accordingly, either to Kuwait Vaccination Center, Kuwait Airport, Shlonik application, and other places. Still, it's not very clear from where to take these 2 months. Some of them were taken 1 month from general surgery, 1 month from internal medicine. Some of them didn't have the opportunity to have the electives, so it's not clear this year. In Kuwait, you can start whenever you want your internship at any time from your graduation, whenever you have your certificate, and you'll go through the process. But usually most of the trainees, they start before 1st of October, if you were willing to apply for Kuwaiti or Saudi board. Also, you can choose any hospital you're willing to start your internship at all, and also you make your own schedule and your own orientation of the rotations, such as you're starting your gynae 1 month, then doing surgery, then elective. You can do it however you want. Accordingly, sometimes some hospitals are overloaded, so they could shift you to other hospital, but usually it goes around. Very briefly, what are the duties during the working hours and what is expected from you? The Ministry of Health working hours are from 7:30 to 2 p.m. What are the duties that are required? Usually paperwork, admission notes, clerking patients, daily progression notes, discharge summaries, and some of inpatient care, such as admission of elective cases, daily assessment, and it's very optional if you're interested to do some minor and major procedures and to get involved with the team. During the on-call, usually most of the rotations, the on-call is every other 4th or 5th day, depending on the rotation you're in and the hospital. It's pretty the same as the working hours, plus some of the emergencies and the acute issues in the ward or ward calls. And always keep in mind that during the on-call, whenever you think the patient is unstable, just always ask for an urgent help from anyone who's senior. Some examples of what you could be expected to see in the on-calls. Some electrolytes imbalances, agitation, seizures, desaturation, shortness of breath, chest pain, and hyper and hypotension. Very important and beneficial guide that we've been using in the past years. Also, it was done a couple of years ago from our colleagues from Kuwait University. It is called the Intern Survival Guide. It's a small booklet and it has everything that you need to know during the internship year. It's very helpful. Most of us used it. Usually they do an orientation for the abroad students or graduates in July, and they distribute a copy from it, and you can follow their Instagram account. And also I think they have a soft copy. Some of the skills that you will be acquiring during the internship, such as insertion of NG tubes, Foley's catheter, doing some ABGs, simple sutures. And for those who's interested in the surgical specialties, you can do your basic surgical skills course. And also you could have the ATLS certificate, which is the Advanced Trauma Life Support. My personal experience as a doctor from graduation until now, I graduated from AGU in 2017, June. I started my internship in Farwani Hospital at September. I was assigned as assistant registrar in Farwani Hospital in orthopedic department a year after, and I was accepted in the Kuwaiti board in January 2019, and I started my residency program October 2019. Okay, we're done with the internship here. We'll go to the Kuwaiti board. And what is KIMS? What is KIMS? KIMS is the Kuwait Institute for Medical Specializations of the Ministry of Health. It's responsible for organizing all aspects of postgraduate education of medical and dental professionals. It organizes the internship training of medical graduates, the specialty and subspecialty education, and continuing the medical education programs. The Kuwaiti board, this is the last year's poster. It has 22 specialties. Every year it differs plus minus 2 to 3 specialties. Just around an hour ago, the current year poster was released, and it has 23 specialties. They added plastic surgery, and it has 5 subspecialties. All of the Kuwaiti board residency programs are 5 years program. The process of Kuwaiti board, as I said before, if you want the Kuwaiti board, you have to finish the training year before 30th of September, because all residency programs start at the 1st of October of every year. Application for the programs usually in January, and only 3 programs in Kuwait have exam, an MCQ exam: internal medicine, dermatology, and orthopedics. All other 19 or 20 programs just have an interviews, usually late January, early February. And you have the option to choose 2 options, first and second option. If you're not accepted in the first option, you can go for the second option. I'll not go through them, but usually this comes with the poster. We'll just go to the middle part. For example, how to apply for the Kuwaiti board. You have the form, you apply it. You have to have at least 3 recommendation letters, some of your personal photos, IDs, and you have to write your CV and other important papers. I'll be talking about the CV later on. KIMS calendar, as I said, the application usually in January, interviews between January to March. The academic year starts on October 1st every year, and exams during the program, usually in September. All the programs have an exam after the second year, after R2. After passing the second year exam, you're going from assistant registrar, and you'll be a registrar, and then you will assigned as a registrar for 3 years, and then you have the final exam of the program at the end of the R5. After that, inshallah, if you pass the exam, you will be a senior, and you will be a board certified. These are the numbers for the last year residency training programs. I'll not go through them, just to keep you in mind, such as example, general surgery, 24 applicants and 8 were admitted. Internal medicine, 27 and 20 were accepted. Urology, radiology, emergency medicine, you can go through them. And in total, around 418 applicants, and 190 of them were accepted as an option 1, their first choice. Just to compare, this was in 2014. As we can see, the applicants were a lesser number, from 310 to 418, and also the number of the admitted doctors are increasing. It was 150, now it's 190. It's very true that now it's more difficult to get a seat in the Kuwaiti boards. However, they're increasing the capacity. So always keep in mind that you have a big chance to compete, and if anyone did it before you. You yourself can do it, and nothing is impossible. Ending my talk in some of the frequently asked questions. I hope I answered them. In a nutshell, how can I improve my CV, or what can I do to make my CV brighter? Of course, if you have the opportunity to do an elective during either the med school or your internship here in your future specialty, if you had any conferences, workshops, you did any courses, any relevant researches, and of course, a working experience in the same future specialty, and very importantly, recommendation letters. And for example, some of the courses and the skills that you need to acquire them or to apply for them, such as in the most of the surgical specialties in Kuwait, and I think everywhere, at least you have to have your ATLS certificate, which is the Advanced Trauma Life Support, the basic surgical skills. In general surgery, it's better to do a surgical laparoscopic skills course, and it's very important to have your own logbook. In ortho, you can do your AO trauma course. In OB/GYN, you can do your advanced life support of obstetrics, ultrasound workshop, perineal repair workshop. These are not a must, but very good examples how to improve your CV. In medical specialties, you can do BLS, ACLS. In pediatrics, you can do the PALS, pediatric advanced life support. And most importantly is to ask the residents whom got accepted in the previous years in the same specialty you're willing to apply to. And believe me, everyone will be willing to help you and to guide you through the route and the correct way. Which specialty would I choose, and how early and where? It's always a tough period and a very tough decision in your life, but you have to take your time and make up your mind. What and where? If you have only one choice, then apply as soon as possible. Otherwise, set your priorities, put your plans, and choose carefully and wisely. And always think of what are your chances for acceptance in each choice. How long will you wait? It's a very important question. Keep it in your mind. Set a deadline for each goal, and always think does it worth the wait? This is, of course, from my personal experience. What is the best order to do my rotations? You can do it whatever you want, but I always advise you start with the specialty that you're most interested in. When can I take a leave? In the first year or in the internship year, at least after 6 months.
Sorry but I just wanted to remind you there is 1 minute left.
It's okay.
Thank you so much.
Welcome. Is there any exam during the internship? No, there is no Kuwaiti license exam. Just for the 3 programs, if you're willing to apply to. And don't forget to follow the intern guide of Kuwait, Kim's account, and you can just take a screenshot for the post-graduation steps, or don't worry, I'll just give you the lectures themselves. Just take a screenshot, or you can capture the QR code for the lecture itself, and it has all the links you need to. Thank you for listening, and if you have any questions, I'll be grateful. And before I end, I just want to thank my colleague, Dr. Saleh Boubshet, because he helped me a lot with this presentation. And if you have any questions or you needed any help, I'll be very grateful in the future, and you can reach me. So any questions, guys?
Thank you, Doctor. We can keep the questions in the chat. How about that?
Okay, great.
they can contact you. The chat here is available for all the students. Thank you so much, Doctor. It was a great talk.